If you ask a patient that you've operated on and done a total knee replacement on one side and a partial replacement on the other side, they'll almost always say, they're both fine, but the partial replacement just feels more normal, doc. I don't know why that is, but it just feels more normal to me. Unlike hip replacement, in which we have to replace both the cup and the ball, in knees, we can sometimes do a partial knee replacement as opposed to a total knee replacement. In the knee, we think about three parts of the knee: the inside half, the outside half, and the kneecap portion in the front. So if one of those three compartments is worn out, but the rest of the knee is not, then we can actually replace just that compartment and leave the rest of the knee intact. That has some distinct advantages. Number one, it's obviously less surgery. Number two, it tends to be a little faster recovery. And number three, the knee feels more normal to patients. That's a very nebulous term, but because the remaining ligaments and cartilage and joint surfaces are still there, the brain is getting that same biofeedback from the knee that it's always had since you were born, and only the part that was arthritic is now artificial. And so that allows people to have a more normal sense of function of the knee. And if you ask a patient that you've operated on and done a total knee replacement on one side and a partial replacement on the other side, they'll almost always say, they're both fine, but the partial replacement just feels more normal, doc. I don't know why that is, but it just feels more normal to me. So if you're a candidate for that, it's a wonderful operation. If you're not a candidate for it, we do not try to push patients into that, and we don't let patients try to push themselves into that category, because everyone wants a smaller surgery, a faster recovery, less pain. Totally understandable. The problem is if one has arthritis in the rest of the knee and one replaces just the worst part, then patients are going to come back saying, I'm better, but the kneecap still kills me, or the outside is starting to bother me. What's going on there, doc? And so we want to make sure we pick the right operation for the right patient. And that can be a tricky process sometimes. So sometimes we use an MRI scan or other ways to figure out if the rest of the knee is arthritic. And I always have to have that somewhat disappointing discussion with patients saying, I know you came in thinking you wanted a partial replacement, but really, if we do that, it's not going to work as well as a total knee replacement. And usually if we walk through the steps as to how we got there and the explanation as to why we think this is better, most patients say, okay, I get it. Let's go ahead and do the total replacement.